Welcome to the Florida Blue PPO Medical Benefits Overview. During this presentation we will discuss how your plan works and review some basic insurance terminology, high-level review of early retirement and Medicare eligibility retirement. We will discuss how the PPO plan coverage works with Medicare and the many advantages, understanding where to go for urgent treatment, and some tools and resources available to you. Let's get started. Note: the high-deductible plan is available to retirees, however is usually only feasible for those who have already been enrolled and saving money in their HSA account. This slide is about commonly used insurance terminology. Calendar year deductible is the amount that some of your benefits apply to first, and this is the amount you pay first dollar coverage, towards your out-of-pocket cost. Resets every year and runs January to December. Once you meet this amount, coinsurance would apply on benefits that do not have a copay. Copays are fixed cost for services, usually for office visits, prescription drugs, and do not count towards your deductible. Coinsurance out-of-pocket, this is the percentage of cost shared between you and the plan. Resets every year and runs January to December. Global out-of-pocket max is the amount you will pay in any given year and includes deductible, copays, and coinsurance amounts. Some of your benefits will apply a per-visit fee, P.V.F., your copay, or a per-admission deductible, P.A.D., or calendar year deductible, C.Y.D. You may also hear reference to ER, the emergency room, or P.C.P., primary care physician. Medicare Part A covers inpatient facility services, including skilled nursing, HHC and hospice. Part B covers professional services by physicians, outpatient hospital, DME, and supplies. This is a high-level benefit overview for both the standard PPO and the high-deductible health plan. This information will be important as we discuss the coordination with Medicare. For the early retirees, the plans will work the same as when you were an active employee. Telemedicine is the distribution of health-related services and information via electronic means. Virtual visits offer immediate care and saves cost and unnecessary ER visits. Virtual visits are a convenient way to deliver and receive care from physicians who have these capabilities. You have two options for telemedicine: virtual visits. Teladoc, a vendor contracted with Florida Blue, is available 24/7, 365 days a year. You can speak with a doctor who is able to listen, diagnose and prescribe medication, if medically necessary. Teladoc Health licensed therapists and psychiatrists are here for you no matter what you are facing, whether it's big or small. Dealing with a rash, acne, eczema or another skin issue? Start an online skin review with a dermatologist by uploading images and details of your concern. You will need to set up a Teladoc account and we recommend you doing so prior to you needing care. You may download the Teladoc app from the Apple App or Google Play stores. Or your current in-network or out-of-network provider may also conduct visits through an audio or visual, telehealth, method. Just ask your provider if he or she provides virtual visit services and if your service is suitable for a virtual visit. For more information on telehealth or virtual visits, call Florida Blue Customer Service at 800-825-2583. Keep in mind, as an early retiree, should you become Medicare eligible due to end-stage renal disease or disability, you should contact People First and Florida Blue. Who is eligible for Medicare? You become eligible for Medicare when you turn 65 and retire from active employment or at any age due to disability, end-stage renal disease. It is important for Medicare-eligible retirees and their Medicare-eligible spouses to enroll in both Parts A and B when you first become eligible. Part A is free, however, Part B has a premium in addition to the PPO plan premiums for secondary coverage. The Part B premium, imposed by SSA, will be much higher if elected at a later date. If you're an active employee or the spouse of an active employee and become eligible for Medicare because of age or disability, you may choose to defer Medicare Part B benefits until you or your spouse retires. Once you are Medicare eligible, Parts A and B, the state of Florida PPO plan for retirees is a secondary policy which includes your prescription drug coverage. This means that Florida Blue will consider Medicare non-covered services if they are covered by the PPO plan. A supplemental policy will only reciprocate benefits of Medicare. It is also important that you notify People First and Florida Blue of your Medicare ID number and effective date as soon as possible to avoid claims processing disruptions. The state employee PPO plan becomes a true secondary policy to Medicare Part A and B, allowing little to no out-of-pocket medical expenses. The state PPO premiums are reduced when Medicare is primary. Same coverage as a retiree as an active employee, out-of-state and out-of-country coverage. Additionally, services that are not covered by Medicare but are covered by the plan will continue to be covered: massage therapy, acupuncture. When utilizing Medicare or Florida Blue network providers, you eliminate the risk of balance billing. Yet you still have the ability to use any appropriately licensed provider that is out of network for covered services. Coordination of benefits. When Medicare is primary, this plan will pay benefits up to the lesser of 1. The covered expenses Medicare does not pay, up to the Medicare allowance, or 2. The amount this plan would have paid if you had no other coverage. Example. Let's say the PPO plan would have paid $100 if it had been primary, and, let's say the Medicare allowed amount was $75 and Medicare applied the full $75 towards your Medicare deductible. The PPO plan would pay the lesser of the amount it would have paid if it had been primary, $100, or the Medicare allowed amount minus the amount Medicare paid to you or the provider. In this example, the PPO plan would pay the provider $75, because Medicare applied its allowed amount to your Medicare deductible, and you would not owe the provider anything. More often than not, with this method of coordinating, you have no patient responsibility. However, I will mention that at the beginning of each year, when your calendar year deductible starts over for Medicare in this plan as well, if you have services rendered that are subject to deductible by Medicare in this plan, we would process your claim towards your calendar year deductible and you would be responsible for the allowed amount. Again, after you have satisfied the Medicare deductible, the coordination of benefits method we discussed makes it where you don't have any responsibility. Florida Blue has a member website dedicated to the state of Florida PPO members. From the website, you can log into your member profile, where you can view your claims and explanation of benefits, which shows the amount you owe the provider. You can see where you are in your deductible and out-of-pocket expenses, and search for a provider. It also has all of your benefit information you need from your plan book and summary of material modifications, summary of benefits and coverage, to forms you may need. The website also contains pertinent information on resources and value-added benefits. This slide highlights the plan document information that is saved on the Florida Blue member website dedicated to the state of Florida, and where you log into the member profile to view claims. Lastly, this slide are important contact information. You have the Florida Blue customer service number dedicated to state of Florida members. You also have the phone number to use when you are looking for a doctor outside of Florida or internationally.